Alzheimer's disease. What if you slowly forgot the people you love, the memories that define you, and even how to live independently? Alzheimer's disease affects millions worldwide, yet many people confuse it with dementia or don't recognize it until it's advanced. In this video, we'll explain what Alzheimer's disease really is, how it's different from dementia, the types, symptoms, treatments, and what you can do to detect it early and possibly reduce your risk. Alzheimer's disease is a progressive brain disorder that slowly destroys memory, thinking skills, and eventually the ability to carry out basic tasks. It happens when abnormal proteins, called amyloid plaques and tau tangles, build up in the brain. These damage brain cells, block communication between neurons, and cause brain shrinkage over time. Alzheimer's is not a normal part of aging, although age is the biggest risk factor. This is one of the most common confusions. Dementia is an umbrella term for memory and thinking problems severe enough to interfere with daily life. Alzheimer's disease is the most common cause of dementia, responsible for about 60 to 70% of cases. Think of it like this: dementia is the category. Alzheimer's is a specific disease within that category. Other causes of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. There are three main types. 1. Late-onset Alzheimer's. Most common, usually appears after age 65, develops gradually. 2. Early-onset Alzheimer's. Occurs between ages 30-65, often genetic, progresses faster. 3. Familial Alzheimer's disease. Very rare. Caused by inherited gene mutations. Symptoms can appear as early as the 30s or 40s. Genetics can play a role in Alzheimer's disease, but most cases are not directly inherited. For late-onset Alzheimer's, the most common genetic risk factor is a gene called APOE4. Having this gene increases risk, but it does not guarantee someone will develop Alzheimer's. For early-onset and familial Alzheimer's, rare gene mutations, such as APP, PSN1, and PSN2, can directly cause the disease. If a parent carries one of these mutations, there is a 50% chance of passing it to their child. It's important to understand that genes load the gun, but lifestyle often pulls the trigger. Many people with genetic risk never develop Alzheimer's, while others without genetic risk still do. Early symptoms: memory loss affecting daily life, difficulty finding words, losing items frequently, trouble planning or organizing, confusion with dates or time. Middle stage symptoms: personality or mood changes, increased confusion, difficulty recognizing people, trouble with daily tasks, wandering. Late stage symptoms: loss of speech, inability to walk or swallow, full dependence on caregivers, severe memory loss. How is Alzheimer's diagnosed? Doctors may use medical history and cognitive tests, brain imaging, MRI or CT, blood tests, newer biomarkers and spinal fluid tests. Early diagnosis is important because treatment works best in early stages. Medications: cholinesterase inhibitors, donepezil, rivastigmine, memantine for moderate to severe stages, newer drugs that target amyloid plaques for early stages. These do not cure Alzheimer's, but they can slow symptom progression. Non-medication treatments: cognitive therapy, physical activity, structured routines, caregiver support, occupational therapy. While Alzheimer's cannot be fully prevented, research shows you can reduce risk. Brain health habits: regular physical exercise, mental stimulation, reading, learning, healthy sleep, social interaction, diet, Mediterranean or Mind diet, fruits, vegetables, fish, olive oil, less sugar and ultra-processed foods. Medical risk control: manage blood pressure, control diabetes, treat hearing loss, avoid smoking. The earlier you start, the better your brain protection. Alzheimer's disease affects not just the person, but entire families. Understanding it early can help with planning, treatment, and quality of life. If you or a loved one notice early memory changes, don't ignore them. Early action matters. If this video helped you, like, share, and subscribe to Clean Health for more clear, evidence-based health education.